I'm gonna help triage you, okay?
Okay.
Yeah.
This simulation is part of our Fostering Healthy Communities class. It's designed to give them some exposure to what it's like to be nurses at an evacuation shelter. We worked with our public health nursing partners who told us that this was something that new grad nurses would benefit from having some exposure to before they graduated.
Because most likely, somewhere in your career, you're going to be exposed to an emergency. Be it, if you're a public health nurse, you're a disaster service worker. So you do get brought in to do shelter work.
We lost everything.
Even hospital bedside nurses will have to know about sheltering and emergencies and evacuation because it could hit a hospital also.
Come on in, George.
We actually asked the students to design the shelter. So they spent some time thinking about how we would physically set up a shelter in a way that was had a logical flow and focused on infectious disease prevention. We had students play evacuees, we had some standardized patients, so actors come and play our evacuees. And we had student nurses playing the public health nurses at the shelter that were responsible for medical triage, so figuring out what people had forgotten behind and how they needed to get it. And then we had student nurses playing shelter leadership.
You're pretty hungry too, and you said you were feeling dizzy.
Yeah, well, I was at the diner having breakfast and when the word came in.
Our prompt was that there was a river that estimated 100-year flood. So many residents had to evacuate their homes and come to one of the nearest shelters, which happened to be ours.
It was fun, a little chaotic. My role was a social service director. In the beginning, there was a big influx of patients kind of getting bottlenecked at the intake area. So I had to think, or my team and I had to think quick on our feet to see how we can mitigate that bottleneck. So we kind of had to disrupt our plan and kind of shift as needed.
And then toward the end, when after 4 days happened, we were trying to get patients out and back to their homes, as well as transportation and housing vouchers for them. It was an eye-opener because so many people come from different backgrounds and you don't really know what resources they have available until they tell you or until you ask them questions. You don't really know what they don't know or what they don't know is available for them.
I was a director of nursing in Nevada County and ended up having to do several shelters with nothing like this. So they now have 4 hours that I did not have. And so hopefully if they ever do have to work in a shelter, those 4 hours have prepared them a little bit better than I was when I had to open one for the first time.
I think the shelter environment asked them to use their critical reasoning, their clinical knowledge, and bring it all together and think about it in the context of a low resource setting. It's stressful and we want to replicate some of that stress now so that if they're in this experience in real life, they've had an opportunity to sort of work through some of those jitters and some of those feelings in a safe place.
Just being patient with the people and kind of working from your heart and a place to want to help them.